Zafonte. We're here at the Spaulding Research Institute, where there's always something extraordinary happening.
You know, years ago when I was a resident, they said, just teach people to adapt. And that's no longer acceptable. It has been our ability to raise the next generation of researchers, to give them an opportunity to leverage their passion. You know, one of the remarkable things about this place is its farm system. Our incredible and young people who you will hear so much about. Their passion will come through today. And I'm a big believer, having a little bit of an athletic background, that there's nothing like an incredible farm system to transform everything. We have an opportunity to really affect so many people's lives.
My name is Randy Trumbower. I'm the director of the lab. And today I am going to give you a little bit of an overview of the exciting research that we do here in the Inspire Lab. So the technology that we're using in this particular experiment to study the effects of our breathing treatment is the HoloLens, which is a mixed reality environment that allows an individual to see everything that we see, but also we can superimpose objects, holograms, and the benefit of this technology is it allows us to create personalized situations. There's no one treatment that can help everyone. And what we're trying to do here is understand what sorts of treatments, when combined together, produce greater effects than anyone alone.
Orthobiologics. What is it and how does it work?
Orthobiologics is exactly what it says. We're using the body's own intrinsic healing ability to try to influence conditions like chronic tendon disorders or chronic joint disorders like arthritis.
How do philanthropic efforts play a role in making it possible to get orthobiologics, for example, to more patients?
We are desperately in need of these funds to advance the field. We're sort of at the tip of the iceberg of this, and this is going to be a huge rebirth of how we treat musculoskeletal injuries. And the attending turned to me and said, we can't change what happened to people, but we can help them move on with their lives. And that was it.
Good afternoon, everyone, and thank you so much for your support to Spaulding Science. Today, I would like to take this opportunity to talk to you about my work in the placebo field research. So we investigated the effects of an open placebo as an active form of treatment, something completely opposite to traditional clinical research. Open-label placebos, which are placebo pills honestly prescribed, have challenged the notion that placebos require either deception or concealment to evoke any therapeutic benefit. And these patients were randomized to receive the conditioning open-label placebo, or COLP, or they went to the treatment as usual arm of the trial. The COLP group decreased 60% from baseline their opiate consumption compared to only 4% in the treatment as usual group.
When the pandemic began, research was interrupted and researchers had to adapt. How did you and your colleagues pivot?
Dr. Zafonte recognized the unprecedented opportunity to study the persistent effects of the virus and mobilized the physical medicine and rehabilitation department's research faculty to establish COVID research infrastructure.
I mean, what you just described is this incredible ability to treat people at a time when there were so many unknowns.
Because, the pandemic taught us that it's possible to dramatically accelerate the time it takes to convert a lab finding into an effective therapy.
Today, I'm going to be talking about reconnecting mind and body in chronic post-concussive syndrome. What is happening in real time for an individual who has post-concussive dizziness and is also really anxious about it? Their body might get very tense because they're anxious and they're worried. And as their body gets tense, their muscles get tense, and it gets much more difficult to actually do any rehabilitation exercises or do balance exercises. There are so many different evidence-based psychotherapeutic approaches that work for people outside of the physical symptoms that can also potentially be applied with effectiveness to those with physical symptoms. So really what we're trying to do here is acknowledge that we have minds, we have bodies, and they're constantly interacting. We have neuroscience that shows how this is the case on the functional neuroimaging level.
Hello, Dr. Zafonte.
Hi, Catherine. can you show us the motion analysis laboratory and give us an insight to the tremendous innovation that occurs here?
One project for which we are using wearable sensors for stroke survivors. The stroke survivors are wearing the 2 bracelets, and they have a tablet as well. As a young researcher receiving some seed funding to be able to run some pilot project is very important, because then it allows you to apply for federally funded grants.
We've met not only a lot of wonderful people, but a lot of people that are really dedicated to helping others.